Good day. Welcome, everybody. Thank you so much for joining us for this conversation. This is the last installment in the Children's Environmental Health's three-part virtual town hall series on lead in drinking water. This is the installment called the Lead and Copper Rule and Lead Service Line Replacement, Opportunities to Accelerate the Removal of an Important Source of Lead Exposure. At this time, I'd like to introduce our Lead and Drinking Water Town Hall Series moderator, Nsedu Obot Witherspoon. Nse is the Executive Director of the Children's Environmental Health Network, where for the past 20 years, she has served as a key spokesperson for children's vulnerabilities and their need for protection. She is a past member of the NIH Council of Councils, the National Academy of Sciences Environmental Health Sciences Roundtable, and the Science Advisory Board for the Centers for Disease Control and Prevention. Currently, Ms. Witherspoon sits on the External Science Board for the Environmental Influences on Child Health Outcomes NIH research work. She's a co-leader for the Science and Health Initiative of the Cancer-Free Economy Network, a leader in the Lead Service Line Replacement Collaborative, and a co-chair of the National Environmental Health Partnership Council. She is also a board member for the Pesticide Action Network, the Environmental Integrity Project, and she was appointed 2 terms to serve on the Maryland Children's Environmental Health Advisory Council. So Nse, the floor is yours.
Thank you so much, Christy, and welcome everyone. Good morning, good afternoon, depending on where you are. Again, very glad to see you all join what we believe is this very important webinar, the third, as Christy mentioned, in this installation of our children's health exposures and lead prevention webinar series that we've been putting on this spring. A big thank you to Christy Truesdale, our Deputy Director, and Hannah Gross, our Program Assistant, for doing phenomenal work on all 3 of these webinars. So just appreciate you both so much. For those that don't know, the Children's Environmental Health Network is a national NGO, non-governmental organization that's been working to protect all children from environmental hazards for close to 30 years now. And lead poisoning is one of the oldest children's environmental health issues that we have worked on and have known about for over a century now. We also know the major routes of exposure and what to do about curtailing those exposures and protecting women of childbearing age, pregnant women, and children, especially when it comes to water contamination as well as a major route of exposure. We've been a leader in the Lead Service Line Replacement Collaborative for many years now. We are working with our partners in water utility, environmental, public health, and the justice arenas to expedite the replacement of lead service lines across this country as quickly as possible. This is a huge public health issue. It's a justice and a humanity issue. Irreversible brain damage due to exposures of pregnant women and children to lead cannot be our continued norm. Back in 2016, Reuters found that nearly 3,000 areas with had recently recorded lead poisoning rates at least double those in Flint, Michigan, during the peak of that city's contamination crisis. And more than 1,100 of these communities had a rate of elevated blood tests at least 4 times higher. The poison places mentioned stretch from Warren, Pennsylvania, which is a town on the Allegheny River, where 36% of children tested at high levels to lead, to a zip code on Goat Island, Texas, where a quarter of tests showed poisoning. In some pockets of Baltimore, Cleveland, Philadelphia, Boston, where lead poisoning has spanned generations, the rate of elevated tests over the last decade was 40 to 50%. We're extremely grateful to have this panel with us today as we narrow down into the lead and copper rule and consider the opportunities that we have before us to accelerate the removal of lead through replacement of lead water service lines. Our first speaker will be Tom Neltner, who will help us set the stage for this discussion. Tom is a chemical engineer and attorney with experience in chemical safety issues in the workplace, the environment, the home, consumer products, and food. Tom has worked on lead poisoning prevention at the federal, state, and local levels for over 20 years. More recently, he has played a leading role in the EPA-convened multi-stakeholder work group that made recommendations to the agency to upgrade its lead in drinking water regulations. He has worked in chemical, food, additive, pesticide, and pharmaceutical manufacturing, as well as state government and public health interest advocacy, with stints as an adjunct professor in Indiana University through many of those years. Tom is also the founder and president of the Indiana-based NGO Improving Kids' Environment, where he and I first met a long time ago, and it's been a continued pleasure to work with Tom over the years. He's a healthy home specialist, certified hazard materials manager, and elected fellow of the National Institute for Hazardous Materials Managers. He is admitted to practice law in Indiana, Washington, D.C., and federal courts of appeal for the Ninth and District of Columbia circuits. And after Tom will be Meg Trubee, providing a utility perspective for us. Meg manages Denver Water's government and community relations team, along with the day-to-day management of public affairs for Denver Water's lead reduction program. She has extensive natural resources policy, public engagement, and communications experience in government and nonprofit sectors. Prior to joining Denver Water, Ms. Trubee gathered a wide range of project experience, including community agroforestry in Senegal, West Africa, environmental compliance on the Big Dig Highway project in Boston, Massachusetts, water policy in Southwest Colorado, and prior to joining Denver Water, she managed the communications and special projects team with the Water Quality Control Division at the Colorado Department of Health and Environment. Ms. Trubee holds a BS and MS in natural resource management with a focus in public administration and conflict resolution. And finally, Maureo Fernandez y Mora will join us by providing a case example of community engagement. They serve as the Massachusetts Associate State Director for Clean Water Action and an alumni of the United World College and Smith College. Originally from New Mexico, Maureo was introduced to the environmental justice movement in high school and spent time organizing around clean energy replacement in predominantly communities of color. While attending Smith College, they joined the Clean Water Action Canvas office in Northampton, Massachusetts. After graduating in 2017 with a bachelor's degree in government concentrating in international relations, Maureo spent some time as a Canvas trainer before joining the Boston program office as a Massachusetts drinking water advocate. Currently, Maureo is focused on lead in drinking water and works to prioritize environmental justice communities that bear a disproportionate burden when it comes to environmental impacts. Maureo believes that care of the environment is, at its core, a social justice issue, which is working to center underprivileged communities in ways that interrupt racism, classism, sexism, and other institutional oppressions. So I'm very excited. Let's kick it off. And as Christy mentioned, as you have questions, please start to add those to the queue. And I invite Tom to start us off. Thank you so much.
And I'd say it's been 20 years. That's quite a nice time of working together over these many, many years. You've held a steady job. I've had a hard time holding one, but it's been good to work with you. And it's good to be here today and talking about some issue that's become really important to me. I've worked on lead in paint for 25 years, lead in drinking water for about 8 years now, and it's just trying to get lead out exposure from everywhere. So I'm here to talk to you, give you a little briefing about the lead and copper rule and the lead service line replacement aspects, just so we have a common understanding. If you can move to the next slide, Christy. So the rule was published on January 15th, 2021 in the Federal Register for those geeks who really want to know that kind of thing. I'm the lawyer, that I like that kind of stuff. But the rule didn't go into effect. EPA put the rule in sort of a hold and is reconsidering it. So we really don't know when it'll go into effect. And the compliance date begins 3 years later. So we're not certain. It could be June, it could be September, it could be some later date. So when compliance has to start is up in the air. But still, it's a really important thing to know that this rule's coming because there's a lot of groundwork. Utilities are working on this every day to try to figure out how to get into compliance. And you and the public health community can work with them to help make that happen. So I want to identify 4 key activities on how we can accelerate lead service line replacement. One is there's this brand new service line inventory. It's the rule's backbone. It is something that's going to transform it. And my dream is that on the paint side, we could overlay not just which homes have lead service lines or may have lead service lines, but which homes have lead paint and really inform people. I'd love to get there. Also, there's 3 new lead service line notices to people served by the water. So there's going to be new information that they're going to get, and that's going to be something that's going to churn for a public health perspective. There's also greater coordination between the water utility and the health authorities, or at least there should be, and that's an opportunity for communication. Last is there's this improved public education for health risks, a new way to talk about health risks of lead that we could use beyond pipes and deal with paint and everything. It's just it's something that reflects the latest science. It's not as strong as I would like, but it is a pretty fair reflection of the science. Let's go to the next slide. So just to get us grounded, there are 6.1 to 9.3 million lead service lines across the country. We really don't know. Just like we don't know how many lead paint, how homes have lead paint, we have estimates. This number is anywhere in between there. I would guess it's more towards the 6.1 number based on what I've seen, but I don't really know. Yeah, for this issue, you have to understand that the service line connects the water main under the street and the internal plumbing. The water main is almost never a lead pipe, although it can happen on the smaller branches. Internal plumbing is almost never a lead pipe, but I've seen it happen in some of the really older communities where they might have installed it. But it's really uncommon to have lead pipes on either side. In between, that one that just serves that house or a building or an office consists of really 2 parts. One is the part on the public property and one on the private part. And they call it a curb stop that divides it. And that's important because most utilities treat it as if they have ownership responsibilities for the part that's on public property, though not all. I think Meg Denver says it's entirely the property owner's responsibility all the way up to the main. So it varies. Almost nobody says it's their responsibility all the way up to the house. So when you get to that part on private property, most utilities will say that is the property owner's responsibility. And as a result, it gets complicated. Who pays for it? Who touches it? You have to get permission to touch it. And you also, to do any of this work, you have to go inside the house, which is a touchy issue for anybody. It's always a complicated one. The problem is a typical part, utilities have done only the part that goes up to the curb stop is a pretty common practice. When they disturb the main, if they encounter a lead pipe, they only replace it up to the curb stop, and that's called a partial. And the problem is a partial lead service line replacement increases, at least temporarily, the amount of lead that may be in that drinking water. So you need to use a filter or more flushing, and it doesn't help us in the long run, although it does get some lead pipe out. What we really want to see is full replacement, the entire pipe out, so nobody has to touch us again. You have to do that carefully, but it really will reduce the lead in the drinking water in the long run. Next slide. So where are they? You could pretty well guess that, Mid-Atlantic and Midwest. Texas and Florida have a lot, but partly because they have a lot of people. The West Coast generally is not thought to have very many because they just never got into the lead mode. But it was a popular material for homes that were built 100 years ago because those pipes are still in the ground. They don't leak. Newer pipes are not going to last that long. So Ohio and Illinois are tops in the list. Illinois is estimated to have about 750,000, and that's a pretty good number, with 380,000 of them in Chicago alone. Cleveland is number 2 with about 200,000. And New York City and Detroit are around 100,000. So that's where we get to our 6.1. Next slide. So the big thing is this new service line inventory. It's not only a count of how many lead pipes or not lead pipes that the utility expects it has, it's going to have the location on it. It's going to be basically a map if the utility is really being transparent. And it has 3 purposes. One is to figure out how we're doing, track progress over the years. Next is to be the basis of communication. So when we talk about notices, it's all built on this service line inventory. Next is to enable states to verify that they're taking water samples at the proper locations. There are 4 categories. Lead, galvanized requiring replacement because it was downstream of a lead pipe. And in that circumstance, Those are lead service lines as well as lead. Lead status unknown. You don't really know yet. Some part of the line is unknown or not lead. That's the gold status, except the EPA's got a very strange definition that means a short piece of lead pipe could be called non-lead. Go figure. A location identifier is a simple word for effectively what we hope is an address. So there'll be every address we hope will have on a map which of those 4 categories it goes to, and hopefully more. All utilities have to make that publicly available, and if it's serving more than 500,000, it has to be posted online. A good example for how that posting online should go is Cincinnati. So next slide. This one is a great map that Cincinnati, and there's about 15 or so communities in Illinois that has done similar maps. Other communities are doing it as well. Washington, D.C. has a great one. But basically it tells you, what do we know? Is it lead? Is it not lead? Well, we don't know. And they didn't separate out galvanized in this one. I think they categorized it as lead. But it's an easy way. But you can see on a map, you can scan and figure out where you stand. Next slide. So let's get to the next one. 3 notices. It goes to persons served by water, which I'm not quite sure what that means. Persons served by water could be anybody who drinks the water, kids at a childcare, people at school, restaurant customers at a restaurant that has a lead service line, because it happens. So we're still working through that. There's an annual and a new customer notice that for each of those various 4 categories, they get an annual notice that says, you've got a lead service line or your line is unknown. And new customers get that also notice. Congratulations, you just bought your very own lead service line. The notice of disturbance of the lead service line is important. Anytime they disturb the service line, like turning on and off the valve, they have to give you a notice. If they do more disturbance, they need to provide you with filter and replacement cartridges and also offer sampling. And if your samples, if you're one of the ones that participates in tap sampling, then you get special notices if you exceeded those levels. And again, coordination with public health community and authorities is next slide. Move to the next slide, please, Christy. And then greater coordination. This is how the public health community can engage in it. Every year, the water utilities have to send to their local and state health agencies copies of their public education materials. And if they're serving more than 10,000 people, if they aren't meeting the replacement goals, they've got to notify you too. But you will also get, if you're in the public health community, notified of sample results over the lead action level of 15 parts per billion, where it is, what the results were, what the results of the sampling is. You don't get those right away, but that's a really good opportunity for communication because that resident's probably going to call the health department. Next slide. So this is the new statement that water utilities are going to be putting out all the time when this rule goes into when compliance is required. It's a new statement of the health effects of lead, and frankly, I think it's pretty good. We could use this in a lot of areas. It's a lot better than the very old one we use on lead paint that came from 1992. The first sentence says it's in all age groups. Infants and children, it identifies the key problems, IQ and attention span, learning and behavior problems. It captures pregnant women in the area, and it also deals with adults. So I like it because it indicates that, yeah, lead gets us at all stages of life, coming and going. Next slide. So this is my contact information, tneltner@edf.org, as well as my phone number. Please reach out to me at any time, but I'd like to turn it back to you, Nse.
Wonderful, Tom. Thank you so much. And now Meg.
Thanks so much, Nse, and thanks so much to the Children's Environmental Health Network. It's really an honor to be with you here today and part of your town hall series. Again, my name is Meg Trubee. I'm the Government Community Relations Manager for Denver Water, and I'm going to address the lead and copper rule revisions and how they apply to Denver Water. But I'm going to do that a little bit later in the presentation so I can give you a snapshot of Denver Water's experience. Can you forward to the next slide, please? Denver Water is Colorado's oldest water utility, a little over 100 years old. Of course, we're here in the city and county of Denver, the heart of the Rocky Mountain West. We serve 1.5 million people with 320,000 water taps in our service area. Because we're in the Rocky Mountain West, we like to point out that our water comes from mountain snowpack, which is why it tastes so great. Next slide.
I didn't get that.
Today, we're talking about lead service line removals and how we can use the lead and copper rule revisions to increase opportunities for lead service line removals. And I want to share with you Denver Water's experience and approach to lead service line removal, because it's a little bit more broad and holistic than just corrosion control treatment or lead service line removal alone. And really, this image that you're looking at gets at the why Denver Water created this comprehensive lead reduction program. Really, the goal was to create a regional solution that improved water quality and protected environmental health. In addition, of course, to protecting those most vulnerable from lead exposure, current and future generations. And there is a main focus on health equity and environmental justice that is woven throughout the program that I'll also be talking about a little bit today. So what is Denver Water's lead reduction program? Next slide. What you see here are the 5 main program elements as represented by the blue bars across the screen. So corrosion control treatment is really the regulatory term for managing water chemistry to reduce corrosion of lead into water. So Denver Water's done that by increasing the pH of our water so that it decreases the likelihood of water getting into the service line, of which Tom had mentioned earlier, that travels into the interior plumbing of a home. And as Tom mentioned, the service line that connects from the main in the street to the first connection in the home, that is owned 100% by the property owner within the Denver Water service area. The second program component is the lead service line inventory, which you saw a snapshot of Cincinnati's online publicly accessible inventory map. Denver Water also has this for all properties within our system. Now, because we don't own the service line, we had to create that inventory from a collection of our tap records, water quality records, field investigations, and a lot of different sources to build an accurate inventory of what exists for service lines in our service area. So you can go to our website and see that information. I'll have that link for you later on. And you can find out if a property is enrolled in our lead reduction program. If we've identified a property as likely to have a lead service line, you're automatically enrolled in the program. Which leads me to the next element of our program, the filter program. If you are part of Denver Water's lead reduction program, in year 1 of our program, which was last year, 2020, we sent you, or we sent everybody, a water filter that is certified to remove lead from water. This provides another layer of protection while residents are waiting to get their lead service line replaced. We also send on a rotating basis replacement cartridges to make sure that that protection is maintained for about 6 months after the lead service line is replaced. That way we can run water quality tests to ensure that no lead is detected in the water column after the replacement has been complete. That leads me to the heart of the program, which is our lead service line replacement program. Denver Water estimates that we have 64 to 84,000 lead service lines in our service area. So just kind of going off of those numbers that you saw earlier, that's what we estimate within our service area. It can take up to 8 hours to replace just one service line. So doing this program will take Denver Water 15 years to complete. We do these replacements at no direct cost to the customer. The final element of Denver Water's lead reduction program is our communications, outreach, and education element that's really woven throughout all of the program, and it's what we're doing here today to talk about our experience as a utility, help others know about how we've approached this problem, and share what information and lessons we're learning. Next slide, please. Earlier, when I showed you that circular graphic, I talked about the importance of honoring the principles of equity. And for the next two slides, I just want to talk a little bit about how we do that and how we incorporate those principles into the program. Since we estimate we have 64 to 84,000 lines in our service area, we have to take some time to figure out where exactly are we going to do that work every year. What you're looking at in the image, in that yellow in the middle, that is the picture of Denver Water's service area. So as you can see, it's a pretty big area for us to figure out where we're going to do the work. We use a model to determine where we're going to do that work annually. So that model takes into account equity considerations, such as the potential for health consequences for those most vulnerable to lead exposure, socioeconomic and demographic data, as well as logistical constraints or opportunities that are related to construction for work planning purposes, such as, is there a paving moratorium so we can't go to that neighborhood? All of this really is to evaluate our inventory of lead service lines and identify where we can work on a year-by-year basis. Next slide. So we really work diligently to honor these principles of equity throughout the program. As you can see in the middle there, I have highlighted the annual work areas already, but we are committed to honoring the principles of equity in every way that we can. So our program is completely bilingual, English, Spanish, that reaches about 95% of our customer base. We do work with community organizations to provide support for other languages spoken in our Denver metro region. We use that same model that I explained in the previous slide to help us deliver the filters throughout our service area for those that are enrolled in the program. In year one, we delivered over 110,000 filters. And of course, as properties change over, we provide them new filters and of course, those replacement cartridges. Again, as we mentioned, the annual work area planning. And we have another section of critical customers where those are the properties that we've identified that serve the target audience of pregnant women or children 5 and under who are most vulnerable from lead exposure. These properties are not incorporated into the model because we've identified them as the highest priority, the target population. We want to make sure we're getting those lead service lines out first. So we're working diligently at getting those done immediately. And then the final piece is our ambassador program, and that's partnering with community organizations to help expand our voice. Next slide. Water, as we know, is something that people don't think about much here in the United States. You turn on your tap and there it is. We take it for granted. And so folks may not know who their local water utility is. And in our case, they may not have ever interacted with Denver Water. So we use and partner with our community organizations that are embedded in neighborhoods throughout our service area to help expand our reach and engage with those folks that they know and trust to get their questions answered. So it's really early in the game for the lead and copper rule revisions, but here's what we know. What you see here are 2 different color texts. So the blue text, these are things that are changing with the lead and copper rule revisions, but Denver Water has been doing them already as part of our lead reduction program. So the service line inventory and publicly accessible data, we have that available. And again, that link will be on the next slide. A lead service line replacement plan, we have that as part of our lead reduction program. And then filter distribution, as I had mentioned earlier, we did that in year 1 of our program where we distributed 110,000 filters to everybody enrolled in our lead reduction program. And we, of course, providing replacement cartridges on a rotating basis, and also, giving people more pitcher filters if they need them because they have larger water needs for their family or they broke their pitcher, etc. What you see there in the black text is stuff that Denver Water is trying to figure out for ourselves, and we're just in those beginning phases. So that includes the changes in notification requirements that Tom had mentioned earlier. notifying people who are served water within a 24-hour period of time requires a pretty nimble response. So we are just having internal discussions about what does that look like for us and what are the systems we need in place in order to do that. There are pretty significant changes to the sampling process that then have additional steps that would be required for sampling instructions, processing those samples, sharing results, and what the results mean. So we are talking internally about what are the sort of the pilot studies we can do on an internal basis to prepare ourselves for changes in the coming years. And then with respect to school and child care facility sampling, we have some of that information already. We maintain a complete list of school and child care facilities. We provide them annual information about lead and its risks, but it would require that we ramp up our communication efforts with them and work more closely with schools about sampling and so on. And we are doing that already with some school districts, but that's certainly a change that we'll need to undertake too. Next slide. Okay, so that was like the fly by the seat of your pants lead reduction program overview, and it's a lot of information. So denverwater.org/lead is our website. And again, I'm going to give a shout out to Greater Cincinnati Water Works because they also have an amazing website with information for folks for that area. But denverwater.org/lead is our lead reduction program webpage. And we also have a newsroom where we talk a lot about things happening at Denver Water. We do our own journalism there. And so denverwatertap.org is where you can see some of our journalism efforts there. And you can sign up for updates on both if you want to stay in touch with us. If you have questions specific to Denver Water's lead reduction program because you live in Denver and you're curious about it, then that email address of lead@denverwater.org and the phone number are great. But otherwise, please get in touch with me. I'm more than happy to talk with you and answer any questions that you have. The final note that I'll say is that we have been getting a lot of questions from folks about how we built our inventory and how we put that online. And we're working internally right now to figure out a way to share that with people in a more publicly accessible manner. So with that said, thank you for your time. Sorry for the interruption. Thanks for coming on back, and I'll turn it back to you, Nse.
Wonderful, Meg. Thank you. And again, you did a stellar job considering all the disruptions. So thank you very much. And our final panelist, before we get to all your great questions, Maureo, please jump in. Thank you.
Awesome. Thank you so much for having me. My name is Maureo Fernandez y Mora, and I'm the Associate State Director for Clean Water Massachusetts. And it is an honor to be a speaker here today. I'm going to try to get through this quickly so we have a good amount of time for questions. Lead service line replacement is an issue near and dear to my heart, and it's been really exciting seeing all this positive momentum recently around the lead and copper rule, as well as Biden's proposed infrastructure plan. We can move to the next slide. Before we get into it, I want to tell you a little bit about clean water. We were formed in 1972, where we worked to pass the landmark Clean Water Act, and we haven't stopped since. We have both a 501c3 and C4. And what that means is we have two separate organizations, one that works on political lobbying where donations are not tax deductible, and another really focused on community education, where we provide free public education to community members on environmental issues like lead in drinking water. The reason I'm highlighting it is because I think it's given us a wide variety of tools to choose from when we are contributing to expediting lead service line replacement across the country. And we can move to the next slide. Before I get into what we've been doing on a local level and sharing some examples and lessons learned from the field, I want to share a bit more high level with you some of our values and defining characteristics that I think have made us a useful partner when it comes to lead service line replacement. It's important to point out that we as nonprofits have no direct control or say in how or when lead service lines are replaced. Our role is really one of thought partner, community galvanizer, cheerleader, and at times pushing municipalities to move a little bit faster on lead service line replacement. And some of the values we communicate always are equitable access to lead service line replacement. What that really means for us is that really the ideal situation is where public utilities are able to cover both the public and private side of replacement so that low-income homeowners, renters, anyone who can't afford replacement isn't left behind. Avoid partial replacements whenever possible for the reasons that Tom outlined before. And then, of course, robust and equitable outreach and community partnership, paying special attention to low-income populations, communities of color, and language-isolated populations. Next slide. Why is it helpful to work with nonprofits? We have really good flexibility when it comes to our messaging. If you're a public utility or a regulatory agency, the script you have to communicate about lead in drinking water is pretty specific. And for nonprofits like us, we can cater messaging really to reach specific populations, which I'll talk more about, but that can look like anything from doing more efforts around language translation, telling people why drinking water is a reproductive justice issue, a racial justice issue, and also reminding people that the ideal amount of lead in drinking water is 0. So even if you're in regulatory compliance, continuing to work to replace the source of lead in drinking water, in this case, lead service lines, is still really important. We can also seek out grants and funds to temporarily increase the capacity of cities around a specific block to expedited lead service line replacement, like community outreach. And we also have the ability to place lead service line replacement into a broader context and highlight the need for more investment in infrastructure in general, as well as racial and economic inequity. Next slide. And when we do all these things together, it creates what I like to refer to as the domino effect, where we've identified opportunities for visible and early success in communities that share common ground with other communities that are facing challenges around lead service line replacement. I'll talk more about how we do that, but it involves establishing community trust, using and investing in community connections, and conducting public events and activities that address multiple goals at the same time. And we can move to the next slide. Tips and tricks I've learned. Build trusting relationships with municipalities is really important. I think, unfortunately, there's sort of this natural inclination to assume that nonprofits and water utilities can't work well together. People assume we're going to make a big stink and paint them in a bad light. And speaking for myself, this really isn't true. No one who is currently alive and working were the people who installed lead service lines in the first place. So for me, this isn't a blame game. This is an opportunity to come together and come up with the fastest and smartest solutions to deal with the issue. Assume and don't assume. Assume good intentions and motivation from all parties. Don't assume that you know the barriers to lead service line replacement in a particular community. Sometimes it's about the money. Sometimes it's about reaching customers. Sometimes it's about better messaging on how road repairs are a nuisance after lead service line replacement. I'll talk more about adapting information about lead in drinking water to be relevant and engaging to a variety of community stakeholders. And then give as much as you get. So as a nonprofit, again, my role is to go in and say more, better, faster, but it's important to recognize really what a stressor on local water departments this issue is, especially if they're smaller size or budget strapped. And so making sure that we're adding to capacity by helping with community outreach, sharing resources and best practices is all super important. Next slide. So what does all of that look like? Well, on the municipal level, it looks like highlighting best practices like avoiding partial replacements, highlighting examples of cities that have successfully financed both the public and private side of replacement, connecting cities with state and federal loan and grant opportunities that can expedite the timeline of lead service line replacement by adding to city budgets. And then increasing capacity for community outreach, which on the community level looks like providing immediately helpful public health information on how to both identify whether or not you have a lead service line and get in contact with the city, as well as tips to reduce lead exposure. We host community education events that do that and that are also targeted towards specifically groups that haven't been as easily reached traditionally. That can include communities of color, language isolated communities, or maybe a group of people that have a specific concern about lead service line replacement, where we can sit down and talk about it with a little bit more time and face-to-face contact than people will get if they're just reading about it in their water bills. And then we also provide a bridge between the municipality and the community. We can provide compensation for community members to be their own ambassadors, just like Meg is doing in Denver, which is awesome. And then we can always place lead service line replacement in a greater narrative, talking about inequity when it comes to drinking water access from a racial and economic standpoint, and also just highlighting the need for more federal and state investment in infrastructure so that cities aren't left figuring it out on their own. Next slide. So examples of adaptive messaging. How do we build messaging that is specific to certain community stakeholders? We can move on to the next slide. So here's an example. You might recognize this picture from the Lead Service Line Replacement Collaborative. So this is a slide that I use in community presentations, and it's called "Whose Problem Is It?" So we talk about how the private side is traditionally the responsibility of the homeowner, but we also name the cost and say, that's a lot of money. Not everyone's going to be able to afford that, which is why we need community members to push local leaders to find a way to finance private side replacement for those who can't afford it. I also like to talk bigger though structurally. The same cities that might have residents who don't have the money to pay for the private side replacement themselves are the same cities who might not have the strongest municipal budget, because budgets are determined by property taxes, income, the hospitality industry. So again, we can provide sort of that upper layer of systemic analysis, really highlighting where there's a bigger problem than just the local lead and water issue. Next slide. Again, tailoring information so that it's the most interesting and relevant to different stakeholder groups that you want to involve in. So talking about lead from a reproductive justice issue, talking about education and incarceration, the fact that lead exposure impacts attention IQ in children, and in adults, lead exposure manifests in irritability and aggressive behavior, and asking people to draw that link between under-resourced communities and over-policed communities that also need more investments in education. And then always talking about the economic benefits. I always like to tout the statistic that it's an estimated $22,000 in cardiovascular benefits alone when you replace a lead service line. Next slide. So the final solution really is getting lead out at the source. Have communities cover the full cost of replacement. Oh, sorry, that slide. Oh, there we go. It's animated. Always covering the full cost of replacement and voluntarily replacing both the public and private side. And then intermediate steps include that public education, running the tap in the morning. I think if you click it one more time, the text will come up. Running the tap in the morning, only cooking with cold water, advising people to use filters if they know they're hooked up to a lead service line, and emphasizing how important it is to develop those accurate inventories. And then last couple slides. Here are some common barriers I've seen: insufficient budget on the local level to be able to pay for public and private side replacement, a lack of community awareness and buy-in. That includes people being worried about road repair nuisance. And a solution to that is nonprofits like us stepping in and helping to head public engagement efforts to work through some of those barriers and objections. And then we can also, again, add to time and staff capacity. Additional issues I've encountered in the field, in addition to the lead service line inventory, a lot of trouble contacting absentee landlords to get their permission to replace the private side, along with immigration concerns. A lot of people of mixed document status that I've talked to have expressed a real hesitancy to interact with anyone from the local government level, even the water department. And so the reason why we often work directly with community members to go door to door and educate their own community about lead service line replacement is to create a sense of safety and community trust. And finally, I just want to show an example of this on the ground. Next slide. Oh, I'm sorry, one more slide after that. So we work directly with Chelsea Green Roots. They're a local environmental justice group that's committed to creating a better environment and quality of life in a traditionally low-income, English isolated, high number of low-income immigrants neighborhood. And so we met with them to tell them about the fact that Chelsea had a significant number of lead service lines. We then met with both Green Roots and the city to come up with a plan for how to tackle this. We held our first public education event a couple months later in 2018, where we started building more community awareness. At the same time, we were assisting the city with applying for a state loan that allowed them to replace both the public and private side of the lead service line and then pay that loan over a zero interest period of 10 years. In December 2018, we held an award ceremony celebrating that Chelsea got that loan. Super important to highlight visible success. And then in June, we started our door-to-door community education campaign, paying local youth from the neighborhood to go door-to-door with myself and Canvas in both English and Spanish, telling people about lead in drinking water, how to reduce their exposure, as well as contributing to an updated lead service line inventory. And we also did work to obtain permission to do work on the private side at no cost to those property owners. And in September 2019, construction began. To date, I think Chelsea has replaced 400 lead service lines in the past 3 years. And a quarter of those replacements were as a direct result of our canvassing program. And so we're super proud of that work. Next slide. Sorry for going a little bit over. So in conclusion, replacing lead service lines is beneficial for human health and well-being, both short and long term. The clear course of action is to replace lead service lines as quickly as possible and as equitably as possible by covering both the public and private side whenever possible. And partnering with groups like us can lead to greater capacity when it comes to that really crucial community outreach, as well as hopefully creating more funds to support local municipalities, both on the state and federal level, so that no one is stuck with a lead service line because they can't afford to replace it. Thank you so much. If you go to the next slide, you'll see our website, and I will also drop it in the chat along with my email. Really appreciate being here.
Thank you so much. Really important points as well. And again, all of our panelists, we now have the Q&A section, question and answer session now open for about the next 25 minutes or so. So one question that I do have here is, how might any of you, and please everyone can answer if you'd like, anticipate that the engagement with public health officials should be progressing or evolving as EPA finalizes the revised lead and copper rule and the utilities are working towards compliance? So many of you talked about some steps, some opportunities, but any further information on thoughts or opinions on what you anticipate will be needed, you know, between these very important communities to leverage, to strengthen, to do better at, so that we can all reap the benefits, all communities can reap the benefits of this new legislation and bill, I should say, bill. Anyone want to take that?
This is Meg. You know, the only thing that I'll really say that, well, that's a big question. The partnership between local, state, and federal officials is incredibly important and can really result in a lot of innovation when we work together well. And so I just really want to encourage this idea that flexibility and innovation are so important, because not every water utility is a Denver Water, right? Not every water utility has the resources to create a program like Denver Water's lead reduction program. And so having that ability to create something that's scalable and flexible is really important. And I think, you know, in the case of the lead reduction program, there was a lot of innovation put in from local, state, and federal officials and all of the partnerships, the other stakeholders that were involved to really come up with that program overall. So just that partnership and work towards innovation is really an important piece that I think needs to be captured.
Thanks so much, Meg. And while we've got you, Janet had asked earlier, does Denver Water include the lead service line on the customer side of the meter, just to confirm?
Yeah, so service line, Denver Water considers the service line the connection from the main to the street to the point of connection at the home. So that includes the curb stop and both sides of the meter. So that's owned 100% by the property owner. That said, we are not immune to partial replacements. And we have a pretty long-standing policy that anytime we encounter a partial replacement, we just go ahead and replace that. That, of course, is part of our program now. But thanks for the question. It is 100% private property from the main to that connection in the home.
Yep, thank you. And also, there's a question as far as data. What are the lead levels in water before filters? And I know that changes obviously per community. Any data on that? And then before lead service line replacement and after. So blood lead levels, I mean, hopefully we should be seeing a very good progressive trajectory here with these major adjustments and changes. But does anyone have some data on that?
I can go ahead and try. There is quite a bit of data thanks to some work from the Water Research Foundation and the American Water Works Association, where they've looked at that and they figured out how to do it. And then they've written a guidance, a voluntary consensus standard on how to do the flushing, because a full replacement will still increase levels if you're not careful. I don't know that they looked at filters beforehand. I know they looked at filters, the effectiveness of filters afterwards. So if you reach out to me, I can connect you up and get you some of those study results.
Thank you, Tom. Maybe we'll add that to some of the follow-up materials, any links you may have.
Yeah.
And thank you. And Maureo, we again appreciate so much the perspective you provided. Could you give a little bit more information on what your work looks like as far as public outreach and events, activities that you're working on?
Yeah, so I think it really boils down to two things. One really is like building the goodwill and trust, both with the municipal staff who are responsible for creating and implementing lead service line replacement programs, and really just connecting them with any best practices or state and federal resources that maybe they themselves haven't had the opportunity or time to find. And that's going to be really dependent on the water systems. There are the Denvers out there who have the time and staff capacity to do that work themselves, and there are others that don't. So I try to add capacity when that capacity doesn't exist. And then the other thing that I really think of my work as is just working backwards from a problem to solve it. So sometimes I'll walk into a community and they'll say, I just don't have time to apply for a loan. So I'll try to make that process as easy as possible by saying, here are the dates, here's everything you need. And sometimes that's my role. Sometimes it's solving a particular community concern. So one thing I found out is that seniors who are really active in local politics hate the road disruptions. And so one thing we're going to try later this summer is holding a community listening session where we just talk about roads and say, I know it's super annoying, but don't you want to make sure that your grandkids have access to lead-free drinking water? So again, it's really being adaptive and just taking the time to learn what are the problems of a specific community, and then seeing if there's a way to solve that through more community engagement. And then the final thing I'll say is really working to distribute resources to compensate community members for being ambassadors and for their local expertise is really important. So one thing that I've done before is I've gotten a grant to do community outreach and then done a pass-through grant to Chelsea Green Roots so that those young people were paid an hourly living wage to go out and be their own community ambassadors.
Some really important points you're raising there. There's a lot of grant writing that's happening among those that are in the participants here. And as much as we can be thinking about, working into our budgets assistance for that type of, ambassadorship that Maureo was talking about, that hands-on experience from the community that is only, truly important to all the work that we do and be more effective and efficient. And also, I heard you talk also about the importance of prioritizing the partnerships and that engagement. That's also very critical However, as we all know, this is not a new issue, right? These are issues that have been around for a very long time. What might be different is our intentionality about making sure that we're working together. And to be fair, during some very critical times of our life, we understand our public health employees are quite busy. Staff are very busy out there across the country on all of our behalf, on many levels, including COVID. But I think the benefit here is that because lead has been around, because there are some great resources and some great examples of how to do it better than not, and some great lessons learned, there can really be some fast tracking here for those that acknowledge that, there's some work to be done that could be enhanced as we work together to implement the lead and copper rule implications. So, Meg, there's some good, and I had this question too. I think a lot of people perked up when you said that you have no cost to the consumer. Can you explain a little bit about how you've been able to make that happen?
Well, we're like 6 months in on year 2 of the program. So I'm just going to come right out and say, the long-term financing for the program, we're still very much figuring that out. But, if I was going to go out and say I had a lead service line at my house here in Denver and I wanted to replace it on my own, it's about $5,000 to $10,000 is sort of the range of the estimate for the cost, right? And so Denver Water is doing 2 things right now. One is we don't charge the customer anything for us to come out and replace that. And if a customer wants to replace their lead service line in advance of when we're going to get to their home, we recognize 15 years is a long time to wait if you're year 8 of the program, et cetera. So we do have a reimbursement program where we will reimburse up to half of what it costs us to replace a lead service line. It costs Denver Water about $5,600 to replace each lead service line as part of this program. So we're doing that through, we have had some contributions from our partners through our own debt financing. That's how we are financing it on the short term. And again, that long-term financing piece is very much in hot discussion here internally at Denver Water for the long-term piece. But that is part of our commitment of this program, is that there'll be no direct charge to the customer. They won't get hit with a $5,000 bill for replacing their line.
Thank you. I mean, that's another critical piece that the lead service line replacement collaborative tries to monitor and track, because that's the big elephant in the room. You'll hear a lot of legislators say it's so expensive. How do we afford this? That type of thing. There's a lot of creative ways. This didn't happen overnight. It's not going to be solved and paid for overnight, but there needs to be a plan for how to do it in the most expeditious way possible. And we continue to be, I think, amazed by, the fortitude that many communities are just digging in again during hard times. The budget isn't officially there, but they're finding ways to make this happen. And that's one case example you just heard. There are many others that are out there. And if you'd like to check out the lead service line replacement collaborative's website, there's some other case examples about paying for these replacements. What about talking about money? What type of water and public health coordination will be needed if Congress hopefully provides $45 million in funding for these replacements? Let's just lift up those very real, realities for, again, being as expeditious and effective as possible.
Yep, I'll go ahead and try that one out. $45 billion is a lot of money. It should fully fund much of the core work, and that's based on an estimate of about $5,000 a line. Now, Meg, you talked about 5 to 10,000. That's on the high side, and part of the goal is to drive that number down. Cincinnati started out with about 5, and now they're down to 3,500. DC was able to drive it from 5 down to a few thousand, 3,000. Every community is going to be different, and you got to find those efficiencies. But we've seen through the pandemic that it really takes a coordinated, clear messaging. That's why, Meg, I find Denver Water so exciting, is the way they worked with the community, and Maureo, the way Clean Net Water Action has worked with the water utilities as public health professionals to try to get the message out in a consistent way. That doesn't mean you're saying the exact same thing. You have different ways and different issues, but that kind of adapting on the fly, clear communications, working with people who may be a better messenger is what it's going to take to get, if Biden talked about getting these lines out in 8 years. Can it be done? I actually think it can be done. Newark, New Jersey was able to get move along the lines on a 3-year schedule. So it can be done quick. Oftentimes the communities are limited by the funding. That's sort of what's exciting about the investment, is it removes that as one of the barriers. Still, there's a lot of work. And I think a big part of the work has to be done in getting jobs to the community. These are blue collar jobs. And blue collar jobs are what people need right now to get the work done. So it's getting more crews out there and streamlining it, and then coordinating it so, as Maureo said, we don't tear up the roads. At least we only do it once. So those are my thoughts, but it's going to take that kind of cooperation, communication, and really mutual respect, as Maureo said.
Thanks, Tom.
And I think the one thing that I would add that I've just seen on the ground is it's really important once you create the funds to communicate them. It's really easy if you're working like 18 hours on an issue to assume that once you've like created all of the funds and you've created the 3 to 4 emails that someone's gonna click the email the first time and say, great, we're applying for that fund. And there's a real need to make advertising funds as they're created as accessible and visible as possible. People, especially water town managers, are getting so many emails all the time. It's really easy to let those slip through the cracks. So making sure that those funds make it into that the applications make it back is super important.
That's right. Yep. Other really good set of points. Any others? I don't see any other questions coming from participants. To our panelists, do you have any final comments you'd like to work in before we close out here?
Well, I'll talk about the rule. I mean, the rule is in this limbo now as EPA tries to figure out, does it accept this one and then modify it? Does it accept it as is? Does it reject this one and start overbuilding on it to make it stronger? And frankly, from a utility perspective, it's a pretty unnerving limbo to be in when you're trying to move forward, but you don't know exactly what's going to be. But I think we just need to work through this. I do think we're going to get a stronger rule out of it. People may vary as to what stronger means, but I think EPA is really serious about fixing the serious flaws that were in the rule. Anytime you call a service line with a few feet of lead pipe in it, non-lead, there's a problem with the rule. So I think there's opportunities to fix this rule to make it stronger. But in the meantime, we need to have utilities and help the utilities do better and getting their service line inventories out there, and to figure out how do you communicate in a way that doesn't scare people, but just gets their cooperation.
Yeah, good points. And Hannah has dropped in the chat the link for providing public comments. The EPA is looking up for public comments on lead and copper rule right now. So we do encourage, we definitely need the public health voice to be there, the voice of reality as far as what is happening out here in communities. If you feel that there is a major challenge to what you're seeing and what is being proposed, raise that issue, bring that up, get on record for those that are able to do that, either as private citizens or through your respective organizations. There is also a question from Sam, is there a way to federally bypass the law where water systems are only responsible for replacing the portion of the line that they own, or create a new law that makes it illegal to have lead service lines? I'll just say for the first part, again, to Tom's points earlier, we do not want to have partial replacements. So it would not behoove the homeowner, the families, and being impacted, the community members, to only pay for half. We really do need to have a solution for the entire lead service line. If it's going to be disrupted, all of it to be taken care of at one time, or you do risk the opportunity of potentially causing harm, at least initially, as Tom said, soon after the replacement. But as far as making it illegal, that's something I think all of us in public health would want. We definitely don't want to go backwards. We want to make sure that this period in our history becomes historical and that we learn from this and do better with our materials and options that are coming in direct contact with the water, the drinking water that we're all reliant on. But Tom, did you have a point?
Yeah, on that last one, Cincinnati took the approach of saying it is, having a lead service line is prohibited, but we're not going to enforce that until we come to you and say, we're ready to work with you to replace the line. And that simple statement of, we don't want lead pipes, this is not where we should be, I think really helped build more cooperation them. They're getting, as I thought, it's about half the people are willing to step up and pay the loan to be able to participate, which is good. So I think in the way we need to be thinking about it is a statement that it's something that's got to stop is a powerful one. Making it illegal is a big step, but it is a powerful way to communicate that. As long as you're not telling people you have to immediately get them out and freaking them out is what you have to be doing the balance. And I think Cincinnati struck a good approach on that one. I know New Jersey's been talking about it. Newark, New Jersey has already been taking that same approach.
I think there's a carrot opportunity there too, instead of a stick. One thing that I like in Massachusetts is there are a few different loan programs, the Massachusetts Water Resources Authority being a main one that requires that if you take money, you only do full replacements and don't use any of the money to do partial replacements, is a great incentive. Another really creative loan that I've seen in Massachusetts is through, I believe, the Safe Drinking Water Fund, where they basically reduce your principal on the interest, so that you're basically paying the same amount to do the public and private side replacement as you would if you had just done the public side replacement. So I think that there are ways to also incentivize and say, you need money, and if you need money, here are the parameters that you need to meet in order to take it from us, is another way to move away from partial replacements.
All really, really good points. Thank you. I don't know of any governor or mayor that wants, any such crisis to really be exposed on their watch, right? And most folks will say, the analysts here, it's not a matter of if, it's a matter of when, because of the lack of maintenance over so many decades. So this is really something that is unavoidable, this conversation, this plan of action. And it's a matter of the political will, I guess, as well as, the funding mechanisms identified for actually getting them done, as well as, I would add, the key critical coordination between public health and the water utilities. It's essential. And of course, the community members only benefit as in the middle of all that. Maureo has also brought up very important pieces about technical assistance, right? That is very important. And we've learned so much. Again, we don't have to reinvent the wheel here. Yes, there are unique attributes to each community, of course, but there's no reason that there aren't tools and resources, and again, groups out there, and obviously advocates out there that are totally willing, such as even leading to potential funding opportunities, right? And ways to really overcome the serious challenges here. But just know that there's a lot of help and reinforcement out here. And we hope that this webinar has helped to maybe expand your thinking or give you some ideas of other partners to reach out to. We're happy at CEHN to help make some of those connections. And you've got 3 fantastic advocates here that I know would be also willing to do what they can as far as networking as well and supporting. We just want to not have this same narrative 10 years from now. We have to make progress. So. All right, well, I want to officially thank everyone for your patience and for your incredible expertise and your knowledge levels with us, Meg, Maureo, and Tom. We really appreciate all of you and your time, and all of you and your who have attended. Please do distribute, get that out to your network, let folks know about this. This is an open resource. We want folks to really take advantage of the information you've passed along. There will also be an evaluation that you get soon after we close out here. So please do fill out that. That's extremely helpful for all of us as we continue to do our best to be stewards of effective science-based information, equitable information for everyone. So thank you, everyone. Thank you, Christine, Hannah, and team, and everyone have a wonderful, safe, and healthy day.